Imagine for a second that you're doing everything right. You're eating your greens, you're staying active in the garden, and you're taking the supplements and medications you've been told will keep you strong as you age. You trust what's in your medicine cabinet. You believe these little pills are your partners in health.
But what if I told you that some of those very same pills, the ones sitting in your bathroom cabinet right now, could be silently attacking the most important organ in your body? I'm talking about a heart surgeon's worst nightmare. After 2 decades in the operating room, Dr. Michael Kent has seen perfectly healthy seniors walk in with hearts damaged not by age or disease, but by the very medications and supplements they trusted completely. These aren't exotic drugs, they're the things you took this morning for your back, the pill you swallowed for your stomach, and the supplement you take for your bones. Today, we're going to talk about 3 specific things, 3 supplements to your daily routine that you should never take together, especially if you're over 60. We're going to uncover the life-saving truth about how these common choices can secretly weaken your heart muscle. This isn't about fear. This is about empowerment, because what you're about to learn could literally add years to your life. Let's start with one that might shock you the most. It's the one we've been told is the holy grail of senior health: calcium supplements. For decades, the message was crystal clear. If you want strong bones and you want to avoid osteoporosis, you must take calcium. Millions of people take these high-dose pills every single day. But there is a hidden side to this story that the scientific community is deeply concerned about. Think about Linda. At 70 years old, she was worried about her bone density, so she started taking a high-dose calcium supplement on her own. Years later, she suffered a heart attack. The strange part? Linda didn't smoke, her cholesterol was fine, her blood pressure was perfect. So why did her heart fail? When you get calcium from food, like dairy or leafy greens, it's absorbed slowly. Your body knows how to handle it. But when you take a concentrated pill, it creates an artificial spike of calcium in your blood. Your bones can't absorb all of that at once. So where does that excess calcium go? It often deposits itself right into your artery walls. This is called arterial calcification. It makes your once flexible arteries rigid and hard, contributing to the very plaques that cause heart attacks. In the medical world, more is not always better. While some studies are still debating the link, the evidence suggests that these supplements can modestly increase heart attack risk. If you are taking calcium on your own, please listen. This is a medical decision that needs to weigh your bone health against your cardiovascular risk. The safest strategy? Get your calcium from your diet whenever possible. Now, let's talk about the second supplement to your daily life, one that many of us pop like candy. I'm talking about non-steroidal anti-inflammatory drugs, or NSAIDs. You know them as ibuprofen or naproxen. They're your go-to for that nagging knee pain or the headache that won't go away. They work brilliantly, there's no denying that. But for those of us over 60, taking these regularly is like playing Russian roulette with our hearts. Let's look at Michael's story. Michael was 72 and loved his garden. To keep up with his rose bushes despite his arthritis, he took an anti-inflammatory pill almost every day. One afternoon, he couldn't catch his breath. His ankles swelled up to twice their size. At the emergency room, the doctors found he was in acute heart failure. It wasn't a new disease that triggered it. It was that innocent little pill. Here is the insidious way it works. NSAIDs block enzymes to stop pain, but in doing so, they interfere with the chemicals that protect your kidneys and blood vessels. This causes your body to retain salt and water. Think of your heart as a pump and your blood vessels as pipes. If you suddenly flood those pipes with extra fluid, that pump has to work at maximum capacity just to keep up. A young heart might handle that stress, but a heart that is already dealing with age-related stiffness or high blood pressure can simply fail. And here's the kicker. If you take a low-dose aspirin to protect your heart, common NSAIDs like ibuprofen can actually neutralize that protection entirely, leaving you completely vulnerable. The third part of this dangerous trio is something marketed as a protector. I'm talking about proton pump inhibitors, or PPIs, drugs like omeprazole or lansoprazole. Millions of seniors take these every morning for reflux or to protect their stomachs from the very pain pills we just talked about. It's a bitter irony. The medication prescribed to protect you from one risk might be creating a much larger danger through the back door. Take Helen, age 68. She was told to take a PPI for life for her reflux. She never questioned it until a routine checkup showed her heart rhythm was completely unstable. Her magnesium levels had plummeted. Magnesium is the guardian of your heart's rhythm. Without it, your heart becomes like an orchestra without a conductor. Dangerous arrhythmias can emerge, making your heart electrically unstable. Because PPIs reduce stomach acid, they also destroy your body's ability to absorb magnesium. But it goes deeper. These drugs might also reduce nitric oxide in your body, the very molecule that keeps your blood vessels flexible. When those vessels harden, the stage is set for a heart attack. These drugs were meant for short-term use, maybe 4 to 8 weeks, but they've become a permanent fixture in our lives, often replacing simple lifestyle changes. Now, why am I telling you to never take these three together? Think about the perfect storm we just created in your body. The calcium supplement is potentially hardening and narrowing your pipes, your arteries. The NSAID is flooding those pipes with extra fluid and salt, forcing your pump, your heart, to work overtime against massive resistance. The PPI is stripping away the magnesium your heart needs to stay in a steady rhythm, making it electrically unstable. When you combine these three, you are asking an aging heart to pump more fluid through harder pipes with a failing electrical system. It is a recipe for a cardiovascular emergency. And we haven't even mentioned how other common things, like oral decongestants, can act as a stimulant, making your heart beat faster and more irregularly, while further constricting those blood vessels. For someone over 60, this can push the heart to the brink. Even certain older antidepressants used for chronic pain, like amitriptyline, can cause your blood pressure to drop suddenly when you stand up, leading to falls and fractures, or even interfering with the heart's electrical impulses. My message today isn't one of panic. Please do not stop taking your prescribed medications abruptly. That can be extremely dangerous. My message is empowerment. You now have information that most people ignore. You know that the pill for your arthritis could be overloading your heart. You know that your stomach protector might be stealing your heart's rhythm. So here is your action plan. First, go to your medicine cabinet. Take a list of everything you are taking, every prescription, every vitamin, every natural supplement. Second, take that list to your doctor and ask these 3 specific questions. Doctor, given my history, is this still the safest option for my heart? Are there alternatives like topical creams for pain or dietary changes for my stomach? Should we be monitoring my magnesium levels or my blood pressure more closely? Every treatment is a balance between benefit and risk. But as we age, that balance shifts. Your heart has worked hard for you for decades. It has carried you through every joy and every challenge. It deserves exquisite care. Don't take any pill for granted, no matter how common it seems. Protecting your heart is the best investment you can ever make in your future. If this information helped you today, I have 2 small requests. First, subscribe to this channel. Our mission is to give you the straight-shooting health information you need to make the best decisions for your life. Second, share this video. Think of your friends, your siblings, or your neighbors. A simple click could start a conversation that genuinely saves a life. Take a look at your cabinet today. Talk to your doctor tomorrow. Take care of yourself because you are worth it. I'll see you in the next video.